Welcome to our Refresh Smile presentation. This is Dr. Scott Frank, and I'm pleased that you have joined us. This particular case is a All-on-4 case in which there was a challenge with available bone. And I'm often asked in the many cases that I do is, what if? And there are always a lot of what ifs. And this particular what if is, what if there's not enough bone to do a traditional all-on-4 procedure. So I'd like to share with you a case that was just completed several weeks ago and demonstrate how one of the unique things about the Refresh Smile or all-on-4 technique is there's almost always a solution for almost all the what ifs. I hope you enjoy the presentation. This Refresh Smile presentation features an immediate full arch reconstruction of the maxilla using bilateral Zygoma implants. The patient we're presenting is John. He's a pleasant 64-year-old male with a chief complaint of very mobile anterior maxillary bridge, which has been mobile for 2 months and compromising his speech and function so much that he can't even close on his posterior teeth. John reports he's had been suffering from bad gums and bone for about 12 years, and 6 years ago his upper incisors were removed and a 6-unit bridge placed number 6 to number 11. A year and a half ago he had a lower bridge fabricated from number 22 to 27. He's a successful businessman interacting with people regularly, and he prefers to have non-removable teeth and to spend minimal time in the chair. He is aware of his progressive periodontal disease and bone loss, particularly in the upper jaw. When he smiles, the mobile bridge is immediately evident. It's especially notable when you retract the tissues, and you can see the extrusion of the anterior bridge. An occlusion is displaced anteriorly. You can see this both on the right and left buccal views. On the occlusal view and the lower views, you can get a better idea of the arch form. The panoramic view quickly demonstrates the osseous defects at number 6 and 11, in which the bone loss is extended beyond the apex of both teeth, which ranges from the numbers 5-6 region and 11-12 region. This poses a significant challenge because in a typical all-on-4 treatment concept, the posterior implants are placed on an angle in front of the sinus right through the canine region. To overcome this, we are going to utilize the Zygoma implants, which are also tilted implants, but rather than being tilted in front of the maxillary sinus, are tilted posteriorly and laterally through the maxillary sinus into the cheekbone or the zygoma. Here is another view demonstrating the zygoma position. These implants are typically between 30 to 40 millimeters in length. On the day of surgery, all the maxillary teeth were removed, the bone was smooth, and in the anterior, implants were placed traditionally in the number 7 and 10 region, and posteriorly 2 zygomas. You can see from the clinical picture that the implants look similar regardless of whether they're zygomas or the traditionally placed implants. Here's an image of the bridge before being delivered to the patient in the occlusal view and the tissue surface view. And then finally, the bridge was delivered, and we have a retracted occluding view and the patient separating. And here is the occlusal view with the bridge delivered. And you can see once again that the Zygoma implants do not really change anything from the standpoint of the conversion or prosthetic results. Here's a smiling image immediately post-op with the local anesthesia still on board. The panoramic, you can see the anterior implants look typical in the 7 and 10 region. And you can see the Zygoma implants look a little unusual. You really need to use a different view to appreciate them. And here you can see on the one side we use a 35 millimeter implant, on the other side a 40 millimeter implant. John presented 1 week later with very little complaints of pain and discomfort or swelling. Extremely happy with his result. Here's a full face smile, 45-degree smile. And you can see we were able to maintain adequate lip support and a satisfactory profile. Here's his close-up smile after the anesthesia was worn off. And finally, here's the retracted views and occlusal view demonstrating how the tissue is healing 1 week later. John is very pleased with his result and already becoming a raving fan. I hope you enjoyed this short presentation of a Refresh Smile case utilizing bilateral zygomas. Of course, feel free to contact me at any time at the office, 847-276-2500, or by email, drfrank@smilesurgery.com. Thank you.